This clip is going to study the mechanics of breathing. So we're going to look at airflow, how is air moving, which muscles are involved, and what is contributing to this movement of air particles. And so let's begin first by identifying the muscles that are going to be involved during normal, quiet breathing. Two muscles that you want to pay attention to, and that is the diaphragm. Diaphragm sits inferior to the left and right lungs. And the second group of muscles that we're going to look at are what we call the external intercostal muscles. And so these muscles are found in between the ribs, and they're going to help enlarge and collapse the thoracic cage and hence lung volume during inhalation and exhalation. So we're going to be looking at these two specific muscles and how they contract or relax as we inhale and exhale. The second important thing to note before we start the discussion here is the movement of air. So it's very important to note that air is always going to move from an area of high pressure to an area of low pressure. And so the two pressures that we're going to be comparing are what we call atmospheric pressure, and we're going to denote that as P ATM, atmospheric, and we're going to compare it to pressure inside the lungs that we refer to as pulmonary pressure. So we're going to be comparing atmospheric pressure to pulmonary pressure, and so we're going to compare the flow of air between the atmosphere and your lungs. So as a rule of thumb, air is always going to flow from high pressure to low pressure. Okay? So when atmospheric pressure is greater than pulmonary pressure, air is going to move into the lungs, into the pulmonary area. When P atmospheric is less than P pulmonary, then air is going to move out from the lungs and into the atmosphere. And so just keep that in mind because we're going to use that information as we study the mechanics of breathing. So let's begin. The first scenario we're going to examine is inhalation. When you are going to inhale, we have a center in our brain, the medulla oblongata, that has a respiratory center, and this is going to establish and set the breathing rhythm. And so this is going to send a message to contract both the diaphragm and the external muscles. So the first step is that the muscles, and I'm going to abbreviate here saying 1 and 2, meaning the diaphragm as well as the external intercostal muscles, they are going to contract. And so when the external intercostal muscles contract, they are actually going to move the thoracic cage upwards. As for the diaphragm, when the diaphragm contracts, it's actually going to move down. So contraction of the diaphragm moves it down. As a result, what you have noticed is that the volume of the thoracic cage will increase or expand. So as a result of this muscular contraction, thoracic cage volume is going to increase. Okay? Now, of course, there is air inside the thoracic cage, inside the lungs in there. And so when the volume increases, the pressure of the air particles are going to decrease. Okay? Because with a larger space, air particles are now more relaxed, so pressure is going to drop. So as a result of this increase in thoracic cage, hence pulmonary volume or lung volume, pressure of the lungs, P pulmonary, is going to decrease. And it's going to decrease to become less than P atmospheric. And so when this happens, you know that the airflow is going to go from an area of high pressure to an area of low pressure. And so this means that P atmospheric is greater than P pulmonary. So as a result, air flows into the lungs. So from the area of high pressure, P atmospheric, from the atmosphere and into the lungs. This is what we call inhalation. Another word is inspiration. All right, so now you can go ahead and pause this video and work your way through the exhalation process. So it's basically going to be the exact opposite of the inhalation process. So if you pause it now and try to work your way through it, and then you can replay this video in order to check your answers as I go through the second scenario. Okay, so now we're going to go ahead and examine what happens during exhalation. And the first step is going to be muscular relaxation. So the diaphragm is going to relax, and as it relaxes, it's going to move upwards. The external intercostal muscles, okay, they're going to again relax, and as they relax, they're going to move the thoracic cage inwards, which means that the volume of the thoracic cage is going to decrease. Okay? So as a result, thoracic cage volume is going to decrease. Okay? And then we've established that as volume increases, pressure decreases. So here it's the exact opposite. So as the thoracic cage or lung volume decreases, pressure is going to increase. So P pulmonary, so pressure inside the lungs, is going to increase due to this drop in volume. And it increases such that it is greater than the atmosphere pressure, so P atmospheric. Again, we know that air is going to move from an area of high pressure to an area of lower pressure. So as a result, air flows out of the lungs, which is known as exhalation or expiration. Okay, so hopefully if you checked your answers, this is exactly what you wrote down, and so now you're able to compare inhalation versus exhalation as a matter of muscular contraction, volume changes, and pressure changes.